This skill is applying a saline moistened dressing. First, you're going to perform hand hygiene, identify your patient, gather your equipment together, and this includes a dressing kit, saline, sterile gloves, and a wound measurement tool. Make sure you check the expiration date. If you want to check with your patient also to see if they need something for pain, you want to do this 30 minutes before you're doing your procedure. After you adjust the bed to the comfortable working height, go ahead and open up your dressing kit, and in the very top will be a waste receptacle. It's red. Go ahead and get that set up. Put on your clean gloves. You want to protect the patient for privacy, so you may want to use a draw sheet or a towel. And remove the dressing. If it gets stuck, you can put some saline, sterile saline on this, just to make it easier to come off. After removing the dressing, you want to take a note of the amount and type of drainage there is, the color, any odor. And you also want to assess the wound for appearance, and you want to measure the wound. Look, and you want to see if there's any tunneling, necrosis, sinus tract, and of course the drainage. Now remove your gloves and put them in your trash receptacle. Using sterile technique, you want to go ahead and set up your sterile field. This involves opening your sterile drape and using sterile technique, place it on your table. Now you're going to take the contents, make sure you're 6 inches above, and place it on your sterile field. Now you're going to pour your saline into the basin. Recap, and now you're ready to put your sterile gloves on. Make sure the student, when they're dumping the contents onto the sterile field, that they're at least 6 inches above the sterile field. So first thing you're going to do is clean the wound. And we're not going to actually put this, because it's betadine, inside the wound, but this is what you're going to use, and you're going to clean the wound. You also use this to measure the depth at this time. Then you can take it over to the tool and measure how deep it is. Now you want to squeeze any excess fluid from the gauze dressing that you have dipped into the water, or the saline. Unfold it and fluff the dressing up, and squeeze out any excess moisture. Now you want to gently press and loosely pack the moistened gauze into the wound. You can use forceps or a cotton-tipped applicator, whichever one is easier for you. When packing, just make sure that it doesn't touch the surrounding skin, that it's all the way inside the wound. And this takes a little bit of time for them to do. And then you can place your ABD pad over the gauze. You can take a few extra gauzes and put those on too if you have them available. Then your ABD, and then your tape. After you secure the dressing, you want to label with the date and the time. And a good way to do this is just to actually write it on a piece of tape and go ahead and put that right on the dressing. And now you want to clean up your workspace, remove all the remaining equipment, place the patient in a comfortable position.